Health Education Lecture Series. All the listeners of Health Education Lecture Series, I am your host Gurdeep Singh Sandhu, homeopathic consultant. My clinic address is 9701 Sarah N. Court, Dublin, California 94568, and phone number 408 687 1899. Anytime when you are suffering from any disease at any age and you are not getting any progress in your treatment, you can call me at 408 687 1899 for second opinion of your disease, and also to know about where are the hurdles, why you are not improving even with the proper treatments. Whatever the treatment is given, generally they help the systems. They help the system so that any other thing, any other infection should not come upon the systems. Whatever it is, the system is already suffering from. What are the symptoms of that one? It should not be complicated with some other type of bacteria, other type of infectious diseases, so that the process may be complicated. Just many time I have given you examples. So there is earthquake. Earthquake has come. Earthquake has to pass its time, whatever it is. But if it is not complicated, if there is no loss of any building, there is no loss of poles, electric poles, and all that one, it's okay. It has come and gone. But just remember, if buildings are falling down, if poles are falling down, it may ultimately complicate the process of repair time to time. But that process should not be included in the earthquake, because we know that the earthquake is a momental action of the earth, momental movements of the earth in a large, you can say, large area of the earth, or some somewhat localized area of the earth in whatever way, maybe in miles or maybe in something like that. But the consequences, results, whatever the outcome will be, that depends whether or not it is complicated or not. And if it's not complicated, no problem. Earthquake comes and go, comes and go. There are various spaces on the earth. There, the earthquakes are coming every day. They do not bother it. Even in Japan, you might have heard that there is a frequency of earthquakes. I don't know what is underneath the earth over there, why they are having that much earthquakes over there. But they have designed their buildings, they have designed their everything, which likely to be fall down. They suppose that it may fall down, so that then they have taken the measures. Even now, in various other countries, they are making the buildings uh, shock proof. If ever there be shock of any earthquake, these buildings can bear all those shocks, and there is a limit. There is a limit that how far the earthquake these buildings can bear and will not fall. Otherwise, buildings were falling. Most of the buildings were falling because they were not having that kind of facilities to absorb the shock and movements of the buildings. In this way, same thing happens in our system, in the body systems, that our body is designed to repair himself. But if ever anything happens with any type of tissues or multiple tissues, they produce something abnormal. They produce some type of reaction which was not their normal routine. They were not doing that in any routine. But now they are doing, just like a simple example, salivation from the mouth. It's not a routine. There is a salivation, but that salivation is a limited quantity just to make moisture inside the mouth. Glands inside the mouth, there are sublingual glands, there are mandibular glands, there are vestibular glands. All those glands are secreting some type of secretions just to keep it moist, just to facilitate the movements of the mouth by talking or even eating at that time. But if it is in excess, that we have the quantity, that yes, this quantity is normal. Just like I'm talking, you don't see any salivation from my mouth. It's a normal. Still, it is facilitating. But if it becomes dry, there is no salivation. Ultimately, it will become difficult for me to deliver the lecture. So means it is in the normal quantity, and normal things are always bearable. But secretion is still there. And if that secretion increases in quantity and in quality, means normally it is not acidic. Normally its pH level is different. But if it's increased in quantity and in quality, and excess of acid is there, ultimately it will cause problems. Same way, whatever happens inside the body has a limit with which body can adjust himself, and the body adjusts those kind of reactions, those kind of setbacks of the diseases. And in this way we are protected always. There are thousands of bacteria, thousands of disease producing organisms which we supposed to, that they can produce this disease, they can produce this type of disease, and various organisms are moving inside our environment. Just you can see, if you are in a closed room, and one of the window at the top is open, and the sunlight is coming from that into the room, and you can see, well, imagine thousands and millions of small particles moving in that light, because light help us to see. Light help us to see the things. Just like if you see eyes, eyes are the organism which can transmit the outer expressions inside to the brain, and it has a limited field. They cannot see in dark, and there is a quantity and quality of the darkness where they cannot see or where they can see. But when the sunlight comes from that window, ultimately that has a stronger light, that has a more powerful light than the usual daylight. Then ultimately we can see those things which are not usually visible by our open eyes. And you can see millions and millions of particles, and we are breathing in those particles. We are breathing in that air which has that kind of contents. Ultimately, we can well imagine. Just assume these are the earthquakes. These are shaking our vitality. These are pressing our vitality. And ultimately, our body is designed that this body can bear this kind of shocks. There will be no turmoil. There will be no falling of buildings. There will be no sickness, because of all these routine things happens every day with our body. But if something happens stronger, beyond our capacity of vitality, that we can bear this thing, at that conditions we fall sick, otherwise not. In this way, bodies have its own capacity to fight against the diseases. To just like the, I am talking about the building, they are having their you can say the suppression springs of the limit, that they cannot fall even if the earthquake comes at 4 or 5 levels. Okay, in that way, our body is designed in this way, and also the body has a limit. Just like The buildings are nowadays buildings are made that they can bear a long and hard stress of the earthquake. The same way, we are becoming healthy time to time by taking care of our health, by environments, preparing the normal environments, by eating food normally, by behaving or living in a normal standards, and our immunity increases, and we do not feel anything abnormal. Even these type of shocks, just like earthquakes, just like the organisms which are causing the disease, and they are in our air, and we can normally we cannot see that. Normally, in our normal day to day routine of environment, you cannot see that. But if that light comes more stronger, we can see those particles moving in our environments, and always we are taking breathing throughout that air, but they do not cause any disease, because our body is self receptor, body is self detective, and it is able to bear that kind of shocks, and we do not suffer about with any kind of disease. But when it becomes weak, at that time, any simple shock, with any simple shock, any wall can fall, any room, floor can fall, something can happen with the tree or the poles. All that depends on the weakness of the poles as well, weakness of the tree roots as well, and also the you can say the bases of our houses. If they are weak, they cannot bear the shocks of earthquake and they fall down. Same way, our body, from the external type of this kind of influences, is influenced every day, every moment, because this universe is moving. This universe as a whole is moving at a big speed, but that speed is not recognized by us. We do not feel that because we born in this environment, and that environment has become as normal. Just like the in the space stations, you might have heard about that thing. The in the space station, they are moving 2800 miles per hour or something like that. The speed is, I do not know the exact thing. I do not want to convey a wrong things, but that is sure that 16 times in an hour, 16 times, not in an hour, in a day, 16 times they have a round of our earth, and 16 times they pass through the darkness, means night, and 16 times they pass through the day, night. It means 24 hours are divided into 16 times, and every environment is changed. And they are acquainted with that one. They are familiar with that one. They do not feel some when they stay over there. Normally, they do not feel it because they are familiar with that environment, and then ultimately we are familiar with this environment. We do not suffer from the diseases. And if something is stronger than that one, under those conditions, we can feel that. We can suffer from the diseases. So, this is the normal thing which happens with our body. But if it is complicated outwardly from anything, from living standards, from eating habits, from living, from other type of organisms and all that, they can also they can cause our body to fall sick. We feel something abnormal is happening with our body, just like the earthquake shakes our earth, and we feel something. That's not normal things. But if that kind of things happens with our body, we have a shock. But normally the shocks comes and go every day. We are acquainted with that one, that environment. We are familiar with when, and we do not suffer from the diseases. But if something else or something stronger comes with that one, then we fall sick. Then we fall sick, and that is the complications. And outwardly medications and outwardly protective measures, whatever we adopt, They are the maintaining factors. They are the maintaining factors. They maintain it. How we can, the shock is coming, the earthquake is coming, and we know that nowadays we are knowing it before that one. Reactor scale and all these things, we are now having the readings. So if we know that, we make pre-planned that what we will do if there is earthquake, if there is a heavy earthquake, what we can do, how we can manage ourselves, all these things. The same way, prophylaxis measures in the medical science are a type of prophylaxis, a type of measures which we can adopt before the disease has come, to make ourselves healthy, to make ourselves protective from any other presumed environment. It's not happening, but it is presumed that, oh, season is changing. I may suffer from something which is abnormal, sneezing, cough, headache, fever, this and that, because season is changing. But if we make pre-planned and adjust our body by our normal food, by our living habits, by our sleeping manners, all these things, then ultimately we will not suffer from that. We will only suffer when we avoid all these prophylaxis measures, when we do not use these kind of measures. And the same way in the earthquake, if we do not have any pre-arrangements before the earthquake comes, and it is advised nowadays, same way as we advise the doctors advise to the public that this thing is coming up, so you take precautions according to that. Oh, now this COVID, and when many of the influenza type of infectious viral diseases are coming up, you have to use the mask. This is what prophylaxis. We are advising the community that this kind of thing can happen, and before that, it's not necessary that it may happen or it will happen. No, just like the earthquake is presumed that is supposed to come, because nearby areas, all these areas are having earthquakes, greater or smaller, and it is assumed that in the near future there may be a big earthquake in the California area. The same thing we can assume about our body. Something may happen any times, but even with the smaller and normal changes, whatever the normal earthquakes, in normal changes, we should be well prepared that if in spite of the normal earthquake, if in spite of the smaller disease exciting factors, we suffer for a longer period, we suffer for a deep type of infection, then how we have to recover that one? So in this way, we should be prepared for that one. So if there is a change of environment, that is not in your capacity to change that. No, 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 there should not be any winter. No, you cannot do that. And there should not be any summer. You cannot do that. It has to. Summer and winter will happen according to its own routine. That is beyond our limit. That's a natural thing. But you have to prepare yourself. Same way about your body for the protection of the diseases. Now we know that most of the diseases are seasonal background, and most of the diseases are something acquired type of nature, means because of our own fault, of eating habits, of living standards, working, and all these things, and the environments. So if we cover all these things, we take precaution of our food materials, we take precaution of the environment. That is, suppose if there is a winter outside, I can give you one example. If there is a winter outside, and you are living in the room, and there is a heater is over there, and someone call you from outside, and you suddenly go out and open the door, you may suffer from the shock like things, immediate change of temperature. Your body may not be able to adjust that one. If it is not able to adjust that one, that earthquake, that shock, you may fall sick. There may be damage inside the body. This is what we have to take care of the environment, and we have to take care of food as well. Just like the foods are different in the summer, the foods are different in winters. Food and clothings management, clothings are different in the winters, clothings are different in the summer, because we try to adjust. We learn it from the nature, and we try to adjust it accordingly. But we avoid this thing, if we avoid this thing and we do not adjust ourselves, or maintain our body, maintain our day to day life according to the situations, we will suffer from that one. And that suffering sometimes may not be normal. It may be a big, complicated type of suffering. A simple, a simple cough and cold, sneezing, that may go beyond 3 weeks, and it is not recovered, because the normal period of all these things are maximum of 21 days. And most of the viral diseases are covered if they are not complicated. Just like the earthquake I told you, if they are not complicated, these are recovered within 21 days. But if it is complicated, it may kill the person. And the worst type of consequences may come out if we do not take precautions about that. The same thing I'm telling you. At every change of season, at every change of environment, at every change of food materials, if you do not take precautions, you will suffer from abnormalities. You will suffer from disturbed body systems, that is known as disease. And that disease sometimes may not be simple. Suppose if you have gone to the party and you have taken the food which is not your normal routine, and next day you feel a heaviness, nauseatic tendency, headache, or sometimes diarrhea, pain, abdomen, gas formation. Ultimately, it will be relieved. The body can recover from this shock in a due period, in a due time of periods. And ultimately, if it is not, it means it has been complicated with something else. And that something else comes from where? From food, from our living habits, from environment, and what type of environments you are in, what type of food habits you have in the routine. But every day, today you have taken a meal which is not your routine. The next day you suffer from something abnormal, pain, abdomen, gas, headache, this and that. And the next day again you are bound to take that kind of food as well. It's not the routine. Then ultimately it may be complicated. The same way, all the diseases, if a person is suffering, body is a self-receptor and is capable of curing himself in a due time, because there is a specific time. I have many times I have given you, the viral diseases have 21 day maximum 21 days period. The incubation period is at 4 days only, and after that the bacterial type of infections, just like pneumococcus, just like other different type of gonococcus, yeah, all these things are having a limited periods of their survival, and after that they are killed by the system. If the system is active and sufficient active, stronger, then this will be killed. But ultimately, if it goes beyond 3 months, means this is the limit of the bacterial type of infections. If body is healthy, if environment is okay, if living habits are normal, then these type of infections are covered within 3 months. And if cough, fever, all these conditions are not recovering within 3 months, then we assume it may be something wrong. So the same way, the diseases are progressing, diseases are complicating if we do not take precautions. So how we learn this one? We learn it from the nature. Nature has taught us. Nobody else. And every day, our brain, is active receptor of all the happenings in our surroundings. Mother does not teach you the many things which you learned automatically. Many of the languages, many of the words you teach automatically from the environment, from the day to day habits. Even someone is not teaching those words to you, but you capture those things. Someone has, even away from you, they are not related with you, But he has used that kind of words, and this brain captures this active receptor. And so many things we take this kind of thing. And it is not only the words, it's not only the living standards. You can change your own living standard, you can change your own eating habits, and you can change on your environment as well. Just like some people cannot be the ACs to sleep in. No, they are suffering from something like body ache, this and that. If they sleep in AC, cold environments, or some of the people cannot bear if they sleep in heat. So different type of natures has different type of demand of environment. And if we are providing the demand of the vitality, we will not suffer from that one. But if we will force anybody that no, you have to sleep in the ACs, oh no, you have to sleep without AC, and body is not adjusting that one, it means you will ultimately fall sick, because this body has its own limit, just like the earthquake shock. This body has limit to fight against this kind of things, but ultimately this body will fall down. Regular repeated earthquakes, regular repeated exposure of this kind of things which are in your food materials, change habits of the food materials, change habits of the living standards, and the environment as well. Just I told you now. In this way, if ever anything is changed and it is not reversed, and you have to bear that for a longer period, ultimately you will not recover soon. It will take a longer period than the normal. In this way, many of the things many of the things we described it depends on the causes of the disease, causes which produces it, and the causes which are still maintained. These are the main things we should consider, just like causes which are just trivially coming. Sudden we have gone to the rains, and after that we came up. Oh, it may be only just wetting the rain and just something sneezing, something you can feel feverish, but ultimately within 2 3 days you will be okay, because body is recovering itself. It's active receptor. But if something happens with your body and you are not adjusting with that, first of all, I would let you tell you, when there is a sudden change in your eating habit, in your living standards, and in your environment, if it's a sudden change and that change is momentarily, not for a longer period, it is momentarily, ultimately, it will go within 1 2 3 days, not more than that, because body itself is active receptor and will recover himself in a short period, if it is not complicated again. If the causative factor which cause you sickness, they are not repeated again, then you will not suffer for a longer periods. And these type of causes are known as exciting factor, which immediately can excite the sickness. Just like you are not addicted to take any pickles, but one day for taste sake you take pickles, and ultimately next day you having a sore throat. But if still you continue taking the pickles and all that, the sour things which are not body is not adjusting, ultimately they become the maintaining factor as well. Once we eat anything, once we change anything in the environments, once we change in the living habits and all that, it is recovered. Suppose one day you have gone to some work and that work was overloaded, and ultimately you have to complete it in timely fashions, and you could not sleep. You could not sleep in time, but next day you take a special rest and the body will recover that one. No problem. But if someone is continuously night watching, if someone is continuously night watching and is not taking a sufficient rest to the body, and if it's not happening in anybody, this is known as maintaining cause, the maintaining the condition. Another example sometimes I give to the people, that every day we are addicted to the food which our mother, wife, or sister, whatever they are making every day, and there is a routine. There is a routine of our food, homemade food, and we are addicted to that one, and the body, our body adjusts that one. But ultimately, under some conditions, you are bound to take food from the hotels, and they make spicy foods. They add different kind of spices and all that one, and you take that one. And ultimately, again, you are bound to take that one because you are not at home, and for a longer period, you are bound to take that kind of food from the outside market, hotel, restaurants, and ultimately, body will say hands are up. I cannot be at this kind of spices and all that was this gun, and you will fall sick. But sometimes it happens that you cannot recognize it. You cannot recognize it that our food is the main cause of my sickness. Most of the people think that if it is related to the food, there may be something gas, bloated abdomen, constipation, diarrhea, this. But no, there are some other additional symptoms, just like the headache, uneasiness, nausea, backache. All these things happen. These are known as the additional symptoms of this kind of things, and which you do not recognize that it is because that we are taking food from the restaurants every day, and body is not adjusting that food. So those kind of things, it's not only the food, even the environment. Body is not addicted to work in the AC every day, and you go to the same office and you tell, yeah, I'm working in this office since 10 years, and this AC is going on the same way. But remember, at that time, your resistance was okay. You are stronger enough to bear this kind of environments of AC. But now, gradually, the vitality has become weakened to this environment, and you are suffering from the diseases. These are known as maintaining causes of the diseases, which we do not blame, because we know that, yeah, we are working in this office since 10 years, or we are eating this kind of food since we born, or since many years and months, because my mother is not with me, my sister is not with me, my wife is not with me. I'm living alone and I'm taking this food from the hotel, a restaurant for since long. But you will not blame that one. And this type of causes, disease producing causes, are known as maintaining causes. Most of the peoples do not recognize these maintaining causes. Just like a friend, someone someone of a friend, if he play like an enemy, we cannot blame him that he might have done this thing against me. We cannot believe them, but ultimately it happens. And if it is real that he is playing like enmity against you, then ultimately you will suffer for a longer period because you do not recognize what is the reason behind that one. The same way, the food, the environment, living standards, which are normal, and you are not maintaining the normal standard of all these things, and ultimately your vitality, the power, living power inside your body will say hands are up, no, I cannot be at this thing again for a longer periods. And you go to one doctor to the other to the other, ultimately because They are just treating your trivial ailments. Yeah, I have a body ache, I have a headache, I have this and that, and they will give you symptomatic type of medications. Maybe Ayurvedic, maybe allopathic, maybe even homeopathic doctors will give you that kind of medications, or just whatever you have told me. It's okay. But that what you are doing, you are just relieving the temporary symptoms which are appearing at this time. But what are the causes behind that one? You do not know, and you are not treating that one. And until and unless you know the actually real causes of those disease, you cannot cure the disease permanently, because you do not know about. These are the maintaining causes, and you must know about that one. That every person, whosoever is suffering from long term form disease and changing doctor to doctor, is not curing, it means he is having some of the maintaining causes along with his body's living standard, that we have to find out. I can give you one example. It's just a joking type of example, but it is real. It's real. One of girl, she was in the Bay Area and she was a nurse. Both husband and wife are working, and they are living in the apartment, just paying the rent and free and earning. Both of them, they were having huge money surplus in the bank. And ultimately, some of them told her, "Okay, you are both of you are earning. Why not you can take a big house? You can, and you can maintain it." And ultimately, she took she bought a house in Sacramento. This is the real story I can tell you. She bought a house in Sacramento that was a very cheap house as compared to the Bay Area. And for us, even she was having still the surplus money in the bank. She bought a home, and both of them, they were working. Ultimately, what happened? She became pregnant, and the third person came to their family. Ultimately, to maintenance that one, their surplus money was gone for taking care of the kids. Either one of them should resign from the job, back up from the job, or they should hire someone to pay that one. And ultimately, that much was not the sufficient amount they were having surplus. So ultimately, everything is gone. Everything is gone, and there's a problem. Oh, if we will not work, and if there be we are off from job, it will be very difficult to maintain, because there are much more responsibilities on our head. Responsibilities of the house, responsibilities of the kid as well, and job as well. So everything, ultimately, she started having headache. And she called me from Sacramento. And I think this is about you can say about 20 years back story. It's a 20 years back story. And ultimately, she consulted me, and I took up her history. When this happened, why this happened, all these things, whatever she was able to explain, she explained me. And ultimately, she told me one thing: "Doctor, when I go to India and I spend vacations for about 1 month over there, I do not have headache. I do not have migraine, anything else. But when I come back and this come to the my flight come to the San Francisco, and and ultimately I start thinking about the responsibilities of the kid, of the house, and of the job, and all that one, and I start headache. The same thing happens. It happened 2 or 3 times. So ultimately, I suggested her, if ever you want to get rid of this thing, because you are taking treatments, you are a nurse, you know many of the medications from your doctor side, and they might have treated you well, but even then you are not getting well. It means something is there which is known as maintaining factor. It's not exciting factor now, it's maintaining factor. You are maintaining the disease, maintaining the reasons behind that headache. So ultimately, I suggest her, it's better not to have house. It's better continue the job, and you will be having a surplus money. You can afford any caretaker of your kid as well, and as well as both of you can work freely, and you will be having a surplus money. You will not be having a headache. I treated her for some time, and side by side, really, he sold her house. He sold her house, and she went to the apartment over there, and she's still there. She is still there, and I cannot name that lady. It is not permitted by the law. So ultimately, she's okay. There was no problem, no headache. So there is no book, any medical science can tell you about this thing, that what are the causes, what are the bacteria, what are the things which will remove that one. No, it was just a maintaining cause. So today, my first thing I told you, just like we started from the earthquakes, our body is designed to bear this kind of earthquakes, this kind of disease producing organisms, and all that one, environment, habit, living habit, food habit, everything. We are able to adjust, and ultimately our body adjusts to a routine. But when we break that routine, ultimately it's a limited period that our body can adjust. Sometimes it cannot. And those things are known as exciting factors. Exciting factor. And that, if you survey your body when you fall sick, and if you survey your body 27 to 72 hours back, now you started headache, or you started feverish, or you started tiredness. Oh, survey your routine up to 72 hours back, 3 days. What you eat, what you did, which was not a routine, and what was the environment. Was there any change from the environments? From three things, you will find out the reasons, the exciting factor of your disease, and you have to remove that one. And if you remove that one, ultimately this disease will recover in a short way, fastly. But the second thing, we do not care about that one. You do not care about that one, and continuously continue the habits according to your demand, environment, your demand of the household, and demand of other things, that, oh no, you have to work hard, oh no, you have to wake up early morning, or oh, you have to work in the night, and ultimately only then you can maintain your family. Ultimately body will say, hands are up, I cannot do, I cannot run according to your routine. But you will say, no, no, since many years I am doing the same thing, it's not a problem for me. It's not a problem for me. But and you will not blame this type of routine of your life. You will not blame this type of routine of your life. But ultimately, medical philosophy has shown us, behind all diseases, in the back of all diseases, there are exciting factors, there are maintaining factors, and there are the third condition, that is known as the fundamental factors. We have discussed two type of factors. Two type of factors today we have discussed, that if there is exciting factor, it's very nearby, that, oh, I took pickles, or I took curds, or I was gone to the change environment, immediately there was heat in the room, and we go outside in the cold. Or if there is a AC, I was working, I was living in the room, and ultimately I go out, there is a sun heat. We suffer from all these things, and all these things are known as exciting factor. And you can find out, whenever you fall sick, you can find out the causes. What are the causes behind that one? And if you remove those causes, and if you are able to remove those causes, you will get well very fast. And the second type of things, if you are suffering since long, and you think, no, my disease is incurable, doctor claim some of the diseases when they are unable to treat that one for a longer period, and there are some additional complicated symptoms inside your body, inside your disease, and they said it's incurable. Most of the diseases are turned incurable by the lab tests, by the other type of doctors' imaginations, estimations, and the test about the machineries. Oh no, 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 no! You are suffering from a chronic. It's incurable. It's incurable. Either you should suffer, live with the same disease, or you should go for surgery for this and this and this, and many things they taken out. No, medical philosophy has taught us that these type of diseases are known as pseudo chronic diseases. P- PSEUDO, pseudo chronic, falsely chronic. Actually, chronic means when there is a big tissue change inside the body, which seems to be irreversible. We cannot reverse it. It's that damaged, liver is that damaged, kidney is that damaged, heart is that damaged, and your age does not allow us the time to recover that one. Everything is recoverable. Everything is recoverable even up to the end of the life, because it depends upon metabolic rate of our body, anabolic and catabolic rate of the body, and that continue up to the last breath. But yes, catabolic rate is increased, anabolic rate is decreased to the extent that we are unable to recover them back. And the age does not allow us sometimes that you can get him. But other than you are able to treat most of the diseases, if you find out most of those patients, those who are recognized as chronic sick, suffering from chronic diseases, they are recovered by the watchful of all these factors, that is the exciting factor and maintaining factor, their living habits, their environmental, their food habits, and all. If you change all these things, if you change all these, it may take time. It's not that the momentary things that, oh, magic will happen. It's not that you have abdomen gas and you have taken some parathas, aloo paneer, this and that, and I told stop it, and next day you. But if you are taking all these things since a long period, it will take time. It will take time to recover, and you should keep patience under those conditions. 3 4 days back, I told you, suppose you have a bundle of notes and tied up with rubber, and now you cannot put any more notes in that bundle. And if you put some bundles, this rubber band will break up. The condition is this one, and you said it is a serious condition. You said it's a chronic diseases, and he is unable to recover from all these things. But the medical philosophy told us, teach us, that if immediately you take up some of the notes out of that rubber, and immediately that bundle will be relaxed. If you find out in any chronic case, maybe arthritis, maybe psoriasis, maybe heart problem, maybe kidney problems, you have to find out the exciting factor, you have to find out the fundamental, maintaining factors, and I will come to the fundamental factors as well next day, because today I don't have, I will be able to explain, but even then I will try it to fundamental factors. So these two factors, mainly exciting factor and maintaining factor, if you go through his history, if you go through his family or living standards and all that, you will come across those causes which are the maintaining causes of his disease. And if immediately you withdraw those causes which you think that may be the reason behind his disease, and immediately he will start feeling better. Though does not mean that he is recovering, doesn't mean that he is fully recovered from that one, but it is sure that at the same time he will start feeling better. He will start feeling better from the disease at the same time, because you have relaxed, you have withdrawn the maintaining causes, of that disease. And this kind of things are known as maintaining causes. And also the diseases are termed not the chronic disease. Diseases are termed as pseudo chronic diseases. And even doctor says there is a definite change in your liver. It's not recoverable. Doctor says there is a change in your joints. It's not recoverable. But if you apply the same formula of nodes, taking up nodes out of that bundle, the bundle will be relaxed. At the same time, yes, the tissue changes which has already taken place in the knee, tissue changes which has already taken place in the liver or kidney or somewhere else inside your body will take time to recover back. Will take time to recover back. But if you time to time, every time, though the potential, the lab test says, oh, you are having fat liver, or you are having fat liver, or you are having inflammation in your kidneys, this and that. There are many more type of kidney diseases, or you are having heart problems, this kind of muscle changes, this kind of a valvular disease, and this kind of pericardial type, many types of things that they tell you that this is the change we have seen in the ultrasound or with the other tests, and also the lab tests are proving this thing. Does not mean that it's a chronic disease. No. If you have started backing up with only the three steps, these are known as the three. So exciting factor, and exciting factor comes in our food, in our living habits, in our environment, and change that one. Then after that, the fundamental factors. In fundamental factors, also the same thing: food habits, living habits, and the environment which you are living continuously. All the three, you have to reverse it. Exciting cars, maintaining cars, whatever may be, but all these three things are, if you change in your routine life, the next day you will start feeling better. You will not suffer from that one. No doubt. The change of the tissue or the replacement of the new tissues or the repair of those the damaged system may take years continuously, may take 1 or 2 years to recover everything, but it will recover, because the moment you started taking care of the maintaining causes, ultimately it is relaxing day to day, it is relaxing every moment, and you have to watch carefully. You will see that yes, it is improving. Yes, it is improving in this way. So the third thing is the fundamental cause. I don't think I have that sufficient time, but even then I can give you one example. Suppose your wife or your mother or your sister has made prantas. She put potatoes, she put other type of spices in that one, and ultimately you take it and you say, Mom, the salt is more. Mom, it's more spicy. But at that time, when that prata has already been cooked, mom is unable to take that back salt. Mom is unable to take that spices out of that one. Try to understand. When sperm and ovum met each other, genetically, they were preserving their own characters of the family, of the forefathers. What type of genetic characters they were having, they are transmitting their characters and mutually mixing up with each other, and the new product, the new life will have the combination of both the characters, more or less. Sometimes there is more characteristic of the mother side, more characteristic of the father side, whatever it is, but they are having a mixing up generations which is coming up. The same way, diseases which are from the exciting factors, the smaller things. Diseases which are from the maintaining factor is our fault. Diseases from the fundamental factoring is not in our control. Previous two types, diseases from the exciting factor, diseases from the fundamental factors, are known as acquired diseases. Acquired diseases means because of our mistakes. In whatever way, it is our mistakes, and we are able to remove that if we know about that one. If we know about that one, we are able to remove that one, we will get well. But even if we know that if we drink, our liver will be damaged. If we continue taking drinking habits, ultimately the liver will be more damaged. You will not recover that. But the moment you start taking it back and you avoid those things which are damaging your liver, and ultimately may take time, but the liver will recover, because the metabolic factor, the natural power metabolic factor, is working inside the body for every cell to repair them when they are damaged by the anabolic rates. And they are body is capable of decreasing the catabolic rate, increasing the anabolic rates, so that every organ can recover. So these all are known as acquired diseases, from exciting factor and from maintaining factor. And sometimes the maintaining factor looks like chronic diseases, but they are not actually the chronic diseases, because for a long term, long period, maintaining factors are attached with your life, and you do not know about that one. And that's why, if you do not know about that one, you cannot avoid them. This is the doctor, this is the medical philosophy who can tell you that these are the maintaining factor and you have to avoid that. If you can avoid, yes, you will get well. After that, we are talking about, just like I gave you the example of a parathas, spices and everything has been added to that one. But now, if someone says, Mom, salt is excess, or Mom, there is a spices, more spices, I cannot bear it. But now, mom is not able to remove that one from the paratha. No, she cannot remove the salt from that one. But what we do, when there are genetic type of diseases, when the diseases are attained, you can say not acquired, are taken from the generation back, and we are suffering with that, but it's not our fault at that time. But what we can do, we can manage those things. But first of all, we have to realize that thing. First of all, we have to identify that thing. That's known as the diagnosis. First of all, we have to diagnose the thing clearly, that these are not acquired things. These are not under exciting or maintaining factor. These are something related to the genetics. And under those conditions, we can advise the patient, or the patient can discipline himself according to that, so that he can maintain his life as a normal. So I will discuss about this thing in the next lecture, that what you can do about that. What are the genetic type of diseases which you cannot cure, and you have to maintain that one. Many of the things are like this one. Some of the things are which are, you can say, the causing some type of physical defects inside the body, and at long distance they are recovered, but they are from the genetic factors. But even then, with the maintenance of normal standard, as the medical science advises us, a person with the genetic diseases even can survive for a longer period. He can survive with a healthy lifestyle. So this is what I want to convey you today. Basically, we are to progress on our routine lecture of health education lecture series, and that health education lecture series, we are at the lower legs. And I was supposed to describe you the femoral triangle, just like Bermuda Triangle, you have heard about that one. The same way, there is a femoral triangle. There are many more other triangles inside the body, and they are having their own importance. The same way, there is a femoral triangle in the inguinal area here, and that is of more importance for not you, but for the doctors. And also, when it is important for the doctors, what for? To treat you, to safeguard you from many things. Okay, so we will discuss about that one in the next lecture. What is the femoral triangle, how it is formed, what are the contents of the femoral triangle, and how we can protect that one, and what we do in a medical science with the femoral triangle. What's the importance of that one? So we will discuss it in the next lecture in this area. So this is Gurdeep Sandhu, your homeopathic consultant. My clinic address is 9701 Sarah and Court, Dublin, California 94568. Phone number 408 687 1899. Anytime when you are suffering from any disease at any age, and you are not getting well, you are tired of the treatments, and you want to know about the causes behind your disease, what are the hurdles in your cure, you can call me, and I can guide you according to the natural principles, that how the nature was curing diseases when there was no medical science. Even then the people were suffering and they were getting cured. How the nature was curing all these, we have learned from the nature. We have learned from the nature, and this is what I can describe you, this is what I can explain you, so that you can get well. So if ever you want to be treated by homeopathic scientific approach to your health, you can call me 408 687 1899. And always I request to all of you, if ever you think these lectures are beneficial and you are getting knowledge from these lectures, please convey this message to all your nearest and dearest, so that they can listen these lectures and they can attain a knowledge, acquired a knowledge, and get well if ever they fall sick, or can protect yourself, their self, from the diseases. They will not suffer. God bless you all. We'll see you tomorrow for the next lecture of Health Education Lecture Series.